naturopath and FX Medicine Ambassador. Today I'm at the 2024 NHAA Herbal Medicine Summit, and I have been lucky enough to grab Dr. Brad Leech off the floor, drag him in front of me, because I really want to pick his brains on prebiotics. Thank you so much for being abducted.
Emma, it's always a pleasure to sit down and chat with you. It really is.
What I wanted to just pick your brains on a little bit today is in the field of prebiotics. We have so many incredible options at our fingertips. But can you just give us a bit of a synopsis of your favourite prebiotic and why?
I don't have a favourite prebiotic because it really depends on the patient sitting in front of us and what their microbiome is doing. So we've got this level of understanding that once we measure the microbiome and we understand who is there, what is their function, we can actually utilise targeted prebiotics to change the ecosystem within the gut. So it's not just about prescribing more fibre in the diet. We've moved past that and gone, what individual prebiotic is going to be most appropriate for the patient. We've got prebiotics like resistant starch found in green banana flour or potato salad. That's one that I recommend to my patients. And this resistant starch can do a number of different things. It can support with increasing butyrate. So butyrate is that short chain fatty acid found within the gut, excellent for gut integrity, gut inflammation, but it can also bring down stool pH. So individuals who have a slow transit time that will end up having quite high pH, we can utilise resistant starch to bring that down. Now, we've got other prebiotics such as pectin, PHGG, we've got GOS, we've got FOS. There are so many different prebiotics that we as practitioners have the ability to utilise, and I really feel like it is at that time that we need to step forward, we need to upskill in the area of prebiotic prescription. And that's exactly what you've done in some of my mentoring programs, where you're educating on how can I utilise targeted prebiotics to change the microbiome.
And I have to say, as a practitioner who's been doing this for a long time, it was so fantastic to think strategically around prebiotics and be very specific about it. And I had a case last week who came back to see me, and I'd asked her to have some green banana flour. She was chronically constipated, and lo and behold, she is now voiding every second day, but she's now voiding, and it was once every 5 to 6 days prior. So being so specific had such an impact on this one case.
And that's the thing. When we actually measure the microbiome, we understand all of these different factors at play. We are making an educated prescription to the patient rather than just guessing, oh, I might recommend this or I might recommend that. We are using evidence-based practice, and that's what we as integrative practitioners, naturopaths, nutritionists, integrative GPs should be utilising to get a better outcome for our patients.
Couldn't have said it better myself. Don't forget, when you're in clinical practice, to treat the person and not the disease. Thank you so much for joining us today. And don't forget to head to the website and get all the resources that we have available.